Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. Today I'll be discussing with you paraplegia in flexion and paraplegia in extension. What is the mechanism? So paraplegia in flexion, you can see that the hip is flexed and the knees are also flexed. This is paraplegia in flexion. Here you can see that the legs are extended at the hip, extended at the knees. This is paraplegia in extension. So hope these two terms are clear to you. Now we look into what is the basic mechanism underlying this. Paraplegia in extension means the vestibulospinal and pontine reticulospinal tracts, which are concerned with the facilitation of the extensor tone, are intact. So patient develops a paraplegia after the spinal shock. These two tracts, which are little resistant to injury, recovers and patient goes into paraplegia in extension. So paraplegia in extension is a less extensive lesion. Whereas in paraplegia in flexion, what is happening? The reticulospinal and vestibulospinal pathways, which are facilitating the extensor tone in the lower limbs, are also damaged. So what happens? The patient develops the extensor posture. Hope this point is clear. So here the vestibulospinal and reticulospinal, especially the pontine reticulospinal pathway, are intact. Here the both are damaged. Hope this concept is clear to you. So now we look into what are the key descending motor pathways that are concerned with the paraplegia and this flexion and extension response. So as we know, this is the motor pathway, the corticospinal pathway, which descends down and goes to the spinal cord. This is the pontine reticulospinal pathway, and this is the lateral vestibulospinal pathways. The medullary reticular formation also, there is a reticulospinal pathway which is predominantly inhibitory. So we are concerned with for these two concepts we require only three pathways. One is the pyramidal tract, second is the vestibulospinal pathway, and third is the pontine reticulospinal pathway. So now we look into how it acts. The vestibulospinal pathway, which is arising from the vestibular nuclei, the lateral vestibular nuclei and the dorsal vestibular nuclei, are predominantly facilitatory for the extensor tone, especially in the lower limbs. Same way, the pontine reticular formation, the pathway is also, the reticulospinal pathway is also facilitatory for the extensor tone in the lower limbs. And when there is an interaction between these two, so when a patient is developing a paraplegia, when these all the pathways are cut off, this produces what is called the paraplegia in flexion. And when the vestibulospinal pathway and the reticulospinal pathway are intact, it produces paraplegia in extension. Hope this point is clear to you. So in the complete spinal cord transection, all the pathways are damaged. Then what happens? There are flexo-reflex afferents. That is, there's connect the pathways in the spinal cord. You remember in a intrauterine life, the child is in the universal flex posture. This is because of the flexo-reflexes. These flexo-reflexes are inhibited by the pyramidal tract. And when all the pathways are damaged and is in a complete transection or necrosis spinal cord, these reflexes get activated. That is why you get paraplegia in flexion in complete transection of the spinal cord. Hope this point is clear to you. Now you know that the legs are represented in the medial aspect. A lesion here, like a tumor or a vascular accident, unpaired anterocerebral artery lesion, can produce a cerebral paraplegia. What are the differences between the cerebral paraplegia and paraplegia due to spinal cord lesion? In cerebral paraplegia, you will never get paraplegia in flexion. Paraplegia in flexion rules out cerebral cause. What's the mechanism? You can see here the cortex gives fibers to the pontine reticular formation. They are mainly inhibitory. So the cortex has got inhibitory influence on the pontine reticular formation. So when there is a cortical lesion occurs here, what happens? The inhibition on the pontine reticular formation is lost. Pontine reticular formation is concerned with the maintenance of extensor tone. So what happens? There is a disinhibition. This leads on to increase in the tone in the extensors in the lower limbs. That is the reason why paraplegia in flexion rules out cortical lesion. Hope it is clear to you. Now we look into what are the differences between various types. So here you can see the cerebral lesion bilateral produces paraplegia in extension because disinhibition of the reticulospinal vestibulospinal pathways. In acute spinal cord injury, you get initially there is flaccidity followed recovery of the vestibulospinal reticulospinal pathway leads on to paraplegia in extension. Severe spinal cord injury goes into paraplegia in flexion. Loss of extensor tone due to destruction of the vestibulospinal reticulospinal pathway and activation of the flexor reflex afferents. Hope you understood the. And what is the clinical significance? Paraplegia in flexion is of grave prognosis. This is an end stage of paraplegia, and what happens? Patient will develop flex contractures. So that is the one point that you should keep in mind. So the paraplegia in extension and flexion, the differences are given here. The paraplegia in extension, the muscles are spastic. In paraplegia in flexion, maybe the tone decreased in chronic cases, but contractures are there. Limb position is extended and adducted, flexed at hip and knees. And the paraplegia extension is typical finding that you get in the upper motor neuron lesion, especially the cord compression. And in reflexes are hyperreflexia with the clonus, but in paraplegia in flexion, reflexes may be absent. So today we have discussed about the mechanism of paraplegia, inflection and extension and the significance. And remember, cerebral paraplegia does not produce paraplegia in flexion because of the brainstem motor pathways remain intact and active. That's we have discussed, producing extensor tone in the absence of cortical modulation. The presence of paraplegia in flexion is a grave sign indicating extensive spinal cord damage. Hope you understood the key differences between paraplegia, flexion, extension and the mechanism. Stay tuned. Thank you.